All right, welcome to the TXA portion of our training. So TXA is a drug that's been around for a while. It's being incorporated more and more for traumatic blood loss. We're actually going to bring it into protocol for traumatic blood loss for some other indications as well, and that's part of what we'll go over in this training. So let's jump right into it. From a protocol standpoint, the administration of TXA can happen under a couple of different guidelines. There are folks who do a 1 gram loading dose that then is followed at the hospital by additional doses, or there are folks who do a 2 gram loading dose. We have elected to go with the 1 gram loading dose, and our loading dose will be an IM injection. This is done for a number of reasons. Rapid onset of the drug, not slowing down scene times, and with our close proximity to trauma centers, gets our loading dose on board prior to arrival. So what is eligible? What kind of blood loss should I be giving this loading dose to? We're calling this massive traumatic injury blood loss. Essentially, there has to be evidence of massive loss. I've got massive trauma bleeding from a wound, from an amputation, or even suspected massive internal bleeding. And I'm shocky. I've got a systolic blood pressure less than 90. So both of those together then allow us to give the 1 gram loading dose to adults. That is 10 mLs. The vial is the 1 gram and 10 mLs. And so you do have to divide that between two large muscle groups. 5 mL should be about the max that you put in a thigh or a gluteal muscle. So it should be divided. The medication is approved in children as well. That dose is 15 milligrams per kilogram. Same indications, massive trauma blood loss and a shock blood pressure. We're using a shock blood pressure in our pediatric patients of 70 plus 2 times age. If you remember back to your PALS days, that was the lower limit of blood pressures in the pediatric population. That 15 milligram per kilogram will time out pretty quick. The max dose obviously is just a gram. And then the same thing to split the dose. So that covers massive trauma blood loss. There actually is a couple of contraindications. We're not using it for GI bleeds. So massive GI bleeds are a contraindication. We do not use TXA for that. And at this time, we're not starting with massive postpartum bleeding, although that may be something we look at in the future. I'm going to move to a second part of the category, which is moderate hemorrhage. In moderate hemorrhage, you don't have to have the shock blood pressure, but it's not an IM dose. It's not a loading dose. In moderate hemorrhage, we're looking at things like a very big nosebleed, bleeding from a tooth extraction, bleeding from post-tonsillar surgery, and those kind of things. You could even have bleeding from a wound. So, for example, if I had a significant laceration on my arm, it's not trauma blood loss, but it's someone who's on thinners, maybe it's elderly with frail skin, then we can do this topical. And the administration is you just take the TXA, soak a gauze, and place the gauze on the area. That's easier on the wounds, decently easy on the tooth. In the epistaxis in the nosebleed, it may be possible to do it that way. It is also possible in both the epistaxis and in the tonsillar bleeds to put the 5 mLs into a nebulized solution and then let that nebulize onto the wound. So for the nebulized solution, we're starting with an adult's of 5 mL. In children, we'll do 10 milligrams per kilogram for the nebulized. That has more to do with the volume in the nebulizer, but also was being that cautious to not create additional problems. All of that being said, a couple of precautions on the massive blood loss. It must be administered within 3 hours of injury. If it's beyond 3 hours of injury, then that can cause more clotting problems than benefit. Please do not delay transport of traumas for TXA administration. That's part of the reason we went to the IM, is to speed this process up. And please remember to communicate to the hospital that they've had a TXA loading dose and to be accurate on the time that that happened. And again, if you have any questions, please reach out to my office, the Office of the Medical Director, or the CQI office, and we will get you answers. Thank you.